We're going to discuss obstructive lung disease. Chronic obstructive pulmonary disease is a common chronic lung disease which cause restriction in the airflow because lungs get damaged or clogged with the sputum. So the person is reporting that he or she is having the breathing problems. If you look into the causes of COPD, smoking, air pollution, inhalation of chemical or industrial fumes are triggering the disease. COPD is having poor outcome if not properly managed, but if we have a good control on the symptoms, we can improve the quality of life of the patient and can reduce the severity and the risk of associated conditions. Emphysema and chronic bronchitis are the two conditions which comes under the umbrella of obstructive lung disease. Now, if we look into the symptoms with which the patient came are shortness of breath. Patient is reporting that he or she is having shortness of breath even on climbing stairs, running, and if the disease got progressed, even on walking or changing position. Chest tightness is also noticed because of excessive sputum producing cough. And in the later stages, when the alveoli get destroyed and patient is putting extra effort on the breathing, then the loss of weight and swelling in the legs, ankle, and the feet are seen in the patient. Now, emphysema. First of all, we look into the journal respiratory airway passage. We inhale from nose or mouth, and then air goes into the larynx and pharynx, and then into the trachea, which divide into the two bronchial tubes, and one goes into the right lung and other into the left lung, which further divided into the primary, secondary, and tertiary bronchi, and ultimately into the alveoli. Basically, the alveoli are responsible for the gaseous exchange, and in the emphysema, these alveoli got destroyed, and as a result, a large airspace is formed in the lung instead of many small ones. The surface area for the gaseous exchange of lung due to the destruction of the alveoli is reduced, and ultimately the amount of oxygen which reach into the bloodstream due to help of these alveoli is reduced. Because the alveoli got destroyed, the air is entrapped in the lung and the patient chest on journal appearance is seen as barrel shaped. Now, chronic bronchitis, which is the inflammation of the lining of the bronchial tubes, which are responsible for carrying air into the lung. To make a diagnosis of chronic bronchitis, first of all, we have to rule out all other lung diseases, and then the patient is assessed for having sputum producing cough for at least 3 months a year for 2 years in a consecutive group. If we differentiate emphysema and chronic bronchitis, we see that emphysema are named as pink peppers, while the chronic bronchitis as blue blotters. In emphysema, we have already discussed that the air is entrapped in the lungs and not properly exhaled on exhalation, so the room for fresh and oxygenated air is reduced. And the person is putting an extra effort to exhale that air and breathing faster than the normal to meet the oxygen demand of the body. Due to the exaggerated effort the person is putting in the breathing, then the person is losing weight, and on the appearance, he is looking thin, dejected, lean, or having a pinkish skin tone. While in the chronic bronchitis, we know that there is inflammation and mucus lining in the terminal bronchioles, so the amount of oxygen which reach into the lung is reduced due to the narrow passageway, and the demand of the body is not properly fulfilled. And secondly, when the person is coughed due to the narrow passage of breathing, the patient is having dyspnea after cough, and their skin is appear as blue, and they are named as blue blotters. If we look into the radiographic findings of emphysema and chronic bronchitis, in emphysema, we see that hyperinflation of lungs with small size of heart, while in chronic bronchitis, lungs are normal in size, but due to cor pulmonale, which is more prominently seen in chronic bronchitis, due to increased pressure on the pulmonary arteries, which put a back pressure on the right side of the heart, right ventricular hypertrophy is seen in the chronic bronchitis. Now, if we look into the generalized causes and risk factor of COPD, the person who are excessively smoking or inhaling chemical or industrial fumes are more likely to having COPD. Genetics play a very important role in COPD. Alpha antitrypsin 1 is made by the liver and secreted into the bloodstream, which helps in the protection of the lung. But in the people who are genetically having deficiency of alpha antitrypsin 1, lung diseases or liver damage are more permanently seen in them. Now, the complication of COPD due to the small size of heart or right ventricular hypertrophy, heart-related conditions are more prominently seen in the patient due to excessive smoking or inhalation of chemical burning or industrial fumes. Lung cancer is also seen in the patient. Depression, which is more prominently seen in the COPD patient as a complication because the patient is cut off from the society or the patient is not even able to perform his or her daily life activities. Now, the evaluation of COPD, first of all, we assess the patient for the risk factors or for the exertional breathlessness, for the chronic sputum producing cough, or for the seasonal infections such as winter bronchitis. X-ray, which is very helpful in excluding all other diseases of lung, is also beneficial in diagnosing of COPD. Pulmonary function test, which is helpful in diagnosing, assessing, or to help to find out the severity of COPD, is very helpful by using spirometry, in which a mouth held device is placed in the mouth of the patient and tip is on the nose, and patient is asked to take a deep breath and blow as hard as possible, and the monitor report the reading, in which we notice the forced vital capacity and forced expiratory volume of the patient, which help in staging of COPD. A blood sample can also drawn from the patient, which help in assessing the blood gas level. Hypoxemia and respiratory acidosis are assessed in the patient, and these are evaluation step